Orlando Health strives to offer everyone in our community the best possible care, including those who have rare conditions. Joining us now to discuss one of those is Dr. Joseph Ibrahim with the Orlando Health Medical Group Surgery. Thanks so much for being here with us today, Dr. Ibrahim.
Thank you, Elizabeth. Pleasure to be here.
So you treat everything from hernias to appendectomies. You are a surgeon, and you have come up with a surgery and perform it very successfully for something called MALS. Explain what that is. Tell us what the acronym is and who has it.
Sure. So MALS stands for median arcuate ligament syndrome. Relatively rare up to this point, but what it is compression of one of the main vessels called the celiac artery that comes off the aorta, gives blood flow to the spleen, the stomach, and the liver. I do seem to see it more in younger females, meaning in the 20s to 40s age group. Historically, it's been a diagnosis of exclusion, right? They've had multiple workups, nothing's come up, and it's kind of been like, hey, let's look at this, maybe this is it. But now with better imaging studies, better prognostic indicators, things like that, better evaluations that are less invasive, we've actually been able to say, hey, this person does have this disease and they would benefit from treatment.
What happens next? Is surgery the next step?
Surgery, unfortunately, right now is the only way to treat this. With this robotic treatment where we go in and actually transect those muscle fibers, transect those nerve fibers, and open up that vessel or allow that vessel to open up, there are no medications that need to be done afterwards. It's an overnight stay, and they really can get back to their normal life pretty quickly.
Earlier, you were telling me about a patient, a young woman who had MALS, and her entire life has turned around.
Right. Now, it's very exciting to see how this has changed her life. She came to us with a 4-year duration of just pain and discomfort.
So, Ms. Taylor, you were having a very rough time. You had over 4 years of pain, nausea, vomiting, and you had no idea what was wrong.
No. When they finally did diagnose me with it, I even straight up asked Ibrahim, was like, is it truly that? And so when he pulled up the x-ray and showed it to me, I went, oh yeah, okay, it's definitely that.
How do you feel about Dr. Ibrahim now?
I love him. He, when I met him, he is the nicest human on planet. He saved my life. He saved everything, because I never thought that there was gonna be an end. And there was.
I'm so happy for you.
Thank you.
That's awesome. It's another reason to choose well with Orlando Health. And if you'd like more information, you can visit orlandohealth.com/general surgery.